Hey, what's up? We are on our second video for the female repro system. So down here we have a sagittal female pelvis. And let's start out with doing some of the external genitalia. So collectively the external genitalia, which is going to be down around here, is called the vulva. We have a fatty region, which is the mons pubis, which is where basically the pubic hair would be. We have a pair of large fatty folds called the labia majora. We see one of the labia majora right here. Within the labia majora, we have a smaller fold. Each is called a labia minora. So we have a pair of labia minora. We see one right here. The labia minora are going to enclose a space called the vestibule. Inside the vestibule, we're going to have the opening for the urethra. And we see the urinary bladder right here. We're going to have the opening for the vagina, and we see the vagina right here. I always think about the University of Virginia, UVA, to remember the order of stuff. Other structures we have in and around the vestibule and the vulva. Right where at the anterior part of the labia minora, we can see part of the clitoris here, and it extends all the way back like so. Analogous to the penis, to the has similar erectile structures like the corpora cavernosa in here. We also have another erectile structure here, and back here we've got what looks like a little apostrophe, maybe, or a comma. That is the greater vestibular gland, also called the Bartholomews gland, and it secretes the mucus that's going to be necessary for lubrication during sexual intercourse. Okay, that's most of our external stuff, and we started doing some internal things as well. We've got the urinary bladder, and we had the vagina, and there's the rectum back there. If we go up the vagina here, we hang almost a 90-degree turn here, and we get to the uterus. So we see the uterus right here. We see an ovary to the side of the uterus. We see a fallopian tube right here, curving down towards the uterus. And maybe if I lift this up, we can see the whole fallopian tube right here. We see an ovarian ligament. We've got the parts of the fallopian tube. We'd find the fimbriae here, although they're not as distinct as the previous model we looked at. We've got the infundibulum, and then we've got the ampulla, and then we've got the isthmus. This would be the fundus of the uterus here. Then we have the body right here, and the cervix would be down around here. Right here we have a ligament that's been cut. It's called the round ligament. And the round ligament, let me actually switch sides here. Here's the round ligament here. The round ligament gives the uterus some anterior support. It actually dives through the inguinal canal and ends up anchored kind of sparsely in the labia majora. I don't know, you anchor something sparsely. I don't know if that's the right word. What else? We do see the fallopian tube again here, and we see the ovarian ligament as well. So remember, it's round ligament, fallopian tube, ovarian ligament. The ligaments are they're bracketing the fallopian tube. Okay, what else? What else? We got our uterus. Yeah, we've got our uterus, of course. And we got our internal structures of our uterus here. We see the fundus of the uterus. We've got the body of the uterus. And we've got the cervix here. Remember on your exam, make sure you pay attention to whether you're being asked for region, layer, function, whatever. We got the perimetrium. Then we have the myometrium, which is the muscle layer, which is going to contract during childbirth, certainly. We've also got the endometrium, which is this reddish layer and this tannish layer here. And on the model here, we've divided the endometrium up conveniently into two parts. This more superficial part, the actual lining, is called the stratum functionalis. The deeper part is called the stratum basalis. The functional part is the one that actually changes. It's the one that responds to estrogen during the first 2 weeks of the menstrual cycle. It thickens, it gets more vascular, more glandular. It also responds to progesterone during the second 2 weeks of the menstrual cycle, and it is going to get even thicker, even more vascular, even more glandular, until pregnancy doesn't actually happen, and the progesterone basically disappears, and this lining is going to be shed and menstruated away. The basalis, the basal layer, is then going to help rebuild a new functional layer. Good piece of advice. When in doubt, if you have to guess stratum functionalis, because it's the one that actually is doing more things. Yeah. We see our cervical canal. We see our internal os and our external os. Again, check out some rugae in there. We've got our vaginal canal here. We see the muscle of the vagina. We've got our fornix in the back, posterior and anterior portions of the fornix. We see rugae in the vaginal canal as well. And what else? I don't know. We've got the internal structure of the clitoris here. We've got a ureter all the way up here. That's about it, yeah. Getting the confirmation that I've hit all the major stuff, so adios.